The Pathway at Scale had conducted an in-depth review of the national and state level health budgets between 2001 and 2021. And this revealed that Nigeria has not met the pledge to allocate 15% of its budget, the annual budget, to the health sector. So in today's webinar, we will assess the 2 decades of spending in the Nigerian health sector and try to understand why the challenges in the sector when it comes to allocations, to release, and to utilization of funding persist, to understand why these challenges persist.
Nigeria has not been able to meet these for obvious reasons, and this is largely owing to revenues. So we have a system where, though we expect so much to be allocated to health and so many other sectors that we consider very important, but the reality is that the revenues will just not allow. The other very important reason is prioritization. In Nigeria, everything is a priority, and I do not see any organization, any system where you can prioritize everything at the same time. I see also a poor management, of national priorities, and I'm dovetailing this into what I call the mismatch between policy and budget. So when we have our policy directives and we have what we think we want to do, how well do we translate that into a budget? Now, the budget is the operating document that gives effect to policy. That should be the case.
Starts from the budgeting process itself. And if I give an example with the 2021 budget, we've seen a situation where we have several projects that are duplicated in the budget. So you have these things listed out and funds allocated to them that ultimately reduce the total amount of money that's even available for spending in the health sector. Then another challenge we have is that projects typically replicate across multiple years, and there is no visibility in the public domain on how much was specifically or how much was specifically allocated to some of these projects in the past years. So if we look at the budget, for example, for a project for a particular healthcare center, PHC in Kano State, that project has occurred in the budget for more than 5 years, and different amounts of money keeps getting allocated to it. But right now, it's very difficult to tell why that is happening. Is it a case of corruption? What has been disbursed to these projects over the years? That figure is not available in public domain. So this is happening across multiple projects where you can't really tell how much has been released for specific projects to determine if some of the incompleteness in the project is a problem of corruption or it's being caused by something else. So I would say that one of the things the government can do slightly better in this regard would be to release or publish the disbursement schedules for all allocated funds, because this is even a requirement in the Fiscal Responsibility Act. So once money is budgeted for any project in the health budget, let the public see the disbursement schedule for each of the projects, so they can tell when money gets to a particular project early or late, and when certain projects are not getting their due allocation on time. It will be possible for civil society to advocate early, potentially on a quarterly basis, for some of this disbursement to be prioritized.
So I give you 2 actions that have been taken, and then I discuss on others which I think should be done. The first is, if you look at the Finance Act 2020 that was recently assented to, there were copious provisions there meant to minimize the leakages, bring more people into the tax net, make tax payment a lot easier, because that is a very significant problem as well. You realize that Nigeria, even amongst the comparator countries in Africa, even in West Africa, the tax to GDP ratio in Nigeria is just about 6%, which is abysmally low. It ranks around half of the West African average. So a lot of things are ongoing to bring more people into the tax net so that they will gladly pay their taxes and to make tax payments seamless. The other thing that is being done is, apart from taxes, there are so many other revenue lines of government which accrue from the government-owned enterprises. A performance management framework has been set up to ensure that more and more revenues of these GOEs are brought into the coffers, and also to limit the discretionary powers.
I think the problem starts from first when the money is allocated, and then it gets to a point where it is first the money is budgeted, allocated. It gets to a point where it is released, but then we do not see there's a problem. There's a problem when there is no document or anything telling us how much you spent. As such, the expectation of refund is a major issue.
I think one of the main reasons why we can potentially see refunds in any government agency at all would be if these funds were released late in the first place. So there may be a situation where maybe the stakeholders were unable to go through with the entire procurement process before the calendar year or the fiscal year comes to an end. So that's why you potentially see some of the funds going back. So late disbursements. Another challenge might be capacity gaps of those in charge of some of the projects in navigating some of the procurement guidelines. That as it may, all of that can be solved by capacity gap and, more importantly, the political will.
The CSOs already play a critical role in the campaign for improved allocation to the health sector. There is always room for us to do more in terms of demanding for more allocation to the health sector, especially in the face of shrinking government revenue and prioritization of other issues, things like security and all of that. With campaigns and demands and advocacy by health sector NGOs, eventually some provisions were made in the budget for vaccine acquisition for COVID, and there's talk about a supplementary budget or something to provide additional funding for vaccine acquisition. So CSOs continue to respond to some of these challenges as need be. But like Ayomide mentioned, if we are not clear about what has been released, we can advocate for compliance with Abuja Declaration, and in the budget document that declaration is complied with the right percentage allocated, but then that is not funded and they go back to funding maybe 1% out of 15%, then that campaign has become a wasted effort because it will not deliver the desired results just by merely budgeting for it. So there's work to be done, and which is why I think that we need to be, as a group, as CSOs, we need to be strategic. We need to deploy collaborative approach in how we engage, because the same people who engage Ministry of Health need to work with partners who engage Ministry of Finance, need to work with partners who engage with BPP that handles procurement in the sector. So the main thing is success will come from collaboration amongst all of the CSOs working in different aspects, because it's not just about the money being sent to the hospitals. It's about the process of releasing the money. It's about the process of making the budget. It's about the process of procuring for these things to be done.
Thankfully, there's a law. We should continue to ask. And then on the advocacy plank, we continue to put pressure, to make demands on state government, call them out. Take, for instance, what budget is doing with the state of states. There are so many states that I have worked with on account of what budget publishes. They are not comfortable. And the next time they want to be able to outdo the other state. So for me, it's a journey. And I think that as we continue putting pressure on the systems and encouraging performance and continue to highlight, calling out the people who are not coming to power, we're going to have a more transparent system as the days go by. Thank you.
The implications, they are quite evident. I don't think it's something that is far-fetched. We have seen how the decline in the allocation to the health budget has affected the quality of health that is accessible to Nigerians. We will continue to not have this desired improved service delivery that we are supposed to get. We are the ones looking at the figures on the budget and the papers. The people on the streets are not looking at it. They just want to walk into an healthcare facility and have access to the facilities that are available. And they don't want to be bothered about the figures or why Nigeria is not doing well or why all of this is happening. But until the first thing that we need to really get right, until from the beginning there is the issue of cutting down cost of governance, down to, like Dr. Afolabi mentioned, cutting down cost of recurrent expenditure. Maybe we reflect more on the developmental capital expenditure, and it would aid us to achieve improved service delivery.
It is both. We need to continue advocacy to push the envelope and to ensure that more and more is allocated to health. And also we need to advocate within the fiscal authorities to ensure that greater efficiency is brought to bear in ensuring greater allocation and utilization.
Nigeria signed up to the Abuja Declaration, committing to allocate 15% of its budgetary allocations to health. 20 years on, we've been unable to meet that commitment. Today's webinar highlighted some of the key issues plaguing Nigeria and its inability to meet this commitment. I want to thank all of the panelists, government side, civil society partners for making the time to attend this webinar, as well as the participants who have joined in government to fulfill its commitment by allocating 15% of its annual budget to health in fulfillment of the Abuja Declarations. Thank you.